for the Trouble in Toyland press conference. I am honored to welcome Congresswoman Kathy Castor and the Florida Consumer Action Network to St. Joseph's Children's Hospital this morning. I would like to acknowledge Sarah Mamowich, our president of St. Joseph's Children's Hospital, and thank her for her support in this message. In addition, Susan McGrath, executive director with the Florida Consumer Action Network, and our own Dr. Juan Carlos Abanzas, medical director of the St. Joseph's Children's Hospital Steinbrenner Children's Emergency Room, will be joining us for a very important message as we head into the holiday season. We see far too many children in our emergency rooms due to exposure from harmful chemicals found in counterfeit toys. What should be a joyful time can turn into a nightmare, and that's why awareness is so critical. We are grateful to have Congresswoman Castor and the Florida Consumer Action Network here this morning to discuss these dangers and how you can avoid them as we move into the holiday season. Congresswoman Castor represents Florida's 14th congressional district, encompassing much of Hillsborough County. She chairs the Select Committee on Climate Crisis, serves on the Subcommittee for Consumer Protection and Commerce, and co-chairs the Children's Healthcare Caucus. Congresswoman Castor and her husband live here in Tampa, where they raise their 2 children. Please join me in providing a warm welcome to Congresswoman Kathy Castor.
Well, thank you, Jimmy. Good morning, everyone. What an honor it is to be here at St. Joseph's as the Thanksgiving season commences. Every year we come together to highlight for parents the Trouble in Toyland report, to give them the tools necessary to keep their kids safe as they head out on their holiday shopping excursions. We couldn't do this last year because we were in the midst of the coronavirus pandemic. So I think it's important at the outset for us to take a moment and thank all of the frontline health workers here at St. Joseph's, at Baycare, and across the Tampa Bay area. They've helped us through the most difficult time in our lives, a time of uncertainty, a time when many people lost loved ones, when many of their loved ones were sick, many who lost jobs. We were faced with great uncertainty. So Dr. And Sarah and everyone here at St. Joseph's, we are grateful to you for everything that you have done day in and day out to help keep our community safe, especially our kids. Last Thanksgiving was entirely different. We did not have a safe and effective vaccine. So much uncertainty. We had people with these various surges in the hospital. I just can't express enough how grateful we are, how thankful we are to all of the frontline health workers for getting us through it and to this point where we can again focus on some things that are a little more normal in our lives, and that's thinking about holiday shopping and having families come together. So we want to make sure that parents get the information that they need on toys, and this is a very helpful reminder. And I want to thank Susan McGrath with Florida, with FCAN and US PIRG, because every year they do the research for this report on dangerous toys. This report highlights a number of those dangerous toys that parents need to look out for that Susan's going to go into in greater detail. These are the choking hazards, the magnets, the scooters and bicycles where you need to be reminded that kids need to wear helmets. And then in this modern world, there are new threats to our kids' safety and welfare, and that's the online games and apps. And this is a particular concern for parents. Parents need to understand that when their children go online or they sign up for a new app, a lot of those apps will collect your personal private information. There have been toys that have taken pictures of households, that have taken recordings. A lot of them gather that personal private information, and parents need to know that they have the ability to turn off and on the privacy settings. They have the ability to control whether or not personal private data on their children is gathered. And this is such a concern now because many of these online apps are gathering the personal private information of our kids and selling that information. Hackers can get a hold of it. So this holiday season, parents, as you're buying those those smart toys and you're allowing your kids to go online more often than ever, please look at the privacy settings and know that policymakers in Washington like me are looking to help parents control their personal privacy. Children should not be targeted with advertisements based upon their personal private information. They should not be allowed to sell the personal private information of our children. So these are kind of the Trouble in Toyland report has modernized as our online world has taken over. Parents need to understand, go through some of those personal private settings and protect the health of their kids. I often say if there was someone sitting outside of your child's window watching their every move, watching what they do, where they go, you would call the police. So it's very important for you to take your children's personal online privacy very seriously to protect them from online harms. But the everyday issues of the choking hazards, the loud toys, the ones that are counterfeit now coming from China and other places are at the fore. So I'm going to ask Susan McGrath from the Florida Consumer Action Network to come up and talk about our Trouble in Toyland 2021 report. Welcome, Susan.
Thank you, Representative, and thank you to the hospital for your leading efforts to provide a safe and healthy environment for all of our children and young folks. We are happy to be able to provide the information for parents this year. This is our 36th annual Trouble in Toyland report, being able to bring awareness about what's safe and what's not for our children during these holiday times. The representative did a great job talking about some of the traditional concerns that are dangerous to our children, the magnets, helmets, the toys that are too loud and damage hearing. Last year we did see a lower reporting of incidents in our emergency rooms, but that's because our parents and kids were at home together, right? So now that we are slowly returning to more normal times and people are going out and returning to work and, we have the ability to be vaccinated, we're seeing more of a recurrence. The biggest thing that we have not seen before that we're seeing this year is the tremendous amount of counterfeit toys and how dangerous those can be. So at the Florida Consumer Action Network Foundation, these are the recommendations we would like to see in Congress: that we pass the INFORM Act, the Integrity, Notification, and Fairness on Online Retail Marketplaces Act, introduced in March, would require online merchants to collect, verify, and disclose certain information from high-volume third-party sellers. The goal of this bill is to thwart sales of stolen, counterfeit, or dangerous consumer products, toys, and other kinds of merchandise. The CPSC should continue to research the health effects of phthalates and to strengthen current standards in accordance with the results. The CPSC should take strong enforcement actions to prevent high-powered magnets from continuing to be sold in the market. The CPSC should be using rulemaking process to strengthen product standards to prevent button and coin battery ingestion. Congress should pass Reese's Law, introduced in September, which would require child-resistant closures on consumer products that use such batteries. The CPSC should consider a more protective small parts test. Children under the age of 3 have died from toys that were bigger than the small parts test, and children over the age of 3 have died from toys considered safe for their age demographics. So thank you again to Congresswoman Castor and the hospital. We will now hear from Dr. Albanese.
Thank you. So each year, the new toys that come out, they all kind of change, but we still have to look at the safety for each one of them. And some of them don't really change. One of the big ones that still is an issue are bike helmets. We still have lots of kids riding bikes without bike helmets, and we have a lot of injuries coming in from those. But it's not just bikes, it's also wearing the helmets when they are on scooters or when they are on hoverboards. We see a lot of injuries from hoverboards that are head injuries from kids losing their balance, falling back, hitting their heads. The other big thing is with these toys, especially the counterfeit ones, they may not be quite as durable as some of the other toys. So we really worry about the counterfeit ones. And as a parent, you probably just need to sit there and play with the toy a little bit. Make sure it's actually, it doesn't break easily. It doesn't have small pieces that the child can swallow. And one of the ways to kind of figure out if they can swallow it is if you use the center of a toilet roll, like the cardboard plastic, if it fits in there, that means a child can swallow it. It's always amazing that kids can't swallow pills, but they can swallow pretty much any toy around kind of thing. So those are the main ones we're seeing. Magnets and batteries are probably our other biggest issue because those are really dangerous. The batteries, it starts to release the chemicals in it that start to break down the esophagus and the stomach, and it can kind of create holes through there that can become very dangerous. The magnets, when they're swallowed, they can go inside and attach to two sides of the intestines and starts making a hole through the intestines that also require surgery. So especially toys that have small magnets, toys that have batteries, be really cautious that batteries can't fall out and that the child can't swallow those. And those are the main ones that we're seeing right now. So in Spanish. So en español, lo que estamos viendo más de todo son problemas que la gente no está poniéndose gorros para montar en las bicicletas a los niños y tienen que empezar temprano con los niños pequeñitos para que se acostumbren. Pero vemos muchos niños que se caen y se pegan la cabeza y no tienen la gorra puesta cuando están en una bicicleta o cuando están montados en un hoverboard o en un scooter. La otra cosa que vemos es problemas con las baterías, que tenemos muchos niños que se pueden comer las baterías o se pueden comer los imanes. Y los imanes y las baterías causan problemas con los intestinos y con el estómago porque a veces necesitan cirugía después para sacarlos. Entonces, esos son bien peligrosos. La otra cosa que estamos viendo es que hay muchos juguetes ahora que no son hechos por las personas, tú sabes, las compañías que son las buenas, son hechas en otros lugares como en China. Tienes muchos problemas porque tienen problemas que se parten más fácil, tienen problemas con los químicos con lo que hacen los juguetes. Y una de las cosas que deben hacer es cuando cogen esos juguetes, juegan con ellos un poquito, siendo padre, asegura que no se rompan y que no tengan problemas que tienen pedacitos que se les puedan romper, que los niños se pueden comer. La otra cosa es, para saber si los niños se pueden comer un juguete, pueden usar el centro del papel de baño, el cardboard, se me olvidó, pero el centro de la cosa del toilet del baño, y pueden usar eso. Si cabe ahí adentro, está del tamaño que pueden tomarlo y los niños se lo pueden comer. Entonces, eso es uno de los tamaños que nos preocupa. Los niños se pueden comer no pueden comer pastillas o se pueden comer los juguetes fácilmente, entonces hay que tener cuidado con eso.
Good, we're happy to take any questions.